We also know part of the attraction for new doctors in particular when they come to rural communities is making sure that they have facilities that have the most modern equipment in it, because that's oftentimes what they're trained on.
The health minister announcing $15 million in planning funds for a rural hospital enhancement program, part of a 3-year, $330 million commitment to invest in rural health projects. The government also says expanding services at rural hospitals, including surgical capacity, will alleviate pressure on health centres in larger cities. Joining us now, Dr. Rithesh Ram, President of Rural Medicine for the Alberta Medical Association. Dr. Ram, welcome to Alberta Primetime.
Thank you. Happy to be here.
All right. As a rural generalist practicing in Drumheller, how do you see this commitment of dollars factoring into the sustainability of rural health care?
Well, Michael, the key to recruitment is retention, and it is very difficult to retain physicians in rural and remote areas when the facilities and available technologies that we have to manage our patients is lacking or outdated. This increased focus on rural medicine by this government is a welcome start to how we can improve the health of our rural, regional, and remote communities. Now, I know there were comments out there that, the opposition believes that spending on rural community projects isn't worthwhile as it's not going to improve urban city emergency departments. It's these type of statements that we take as really demoralizing our rural healthcare workers. Rural must continue to be the focus moving forward. We need any and all funding and supports that the budget makes available to us. For decades, Michael, we have done so much with so little, and I'm happy to see that there's going to be a focus on us now.
Okay, well, now the initial phase is to evaluate 20 selected health facilities for upgrades. How does the rural infrastructure dynamic compare to hospitals in Alberta's larger centres? To what degree does equipment in rural areas need to be modernized?
Oh, so that depends how many times you want me to use a multiplier there, Michael. So in comparison to the technologies, the services, the investigations, the blood tests, anything that we would like to order in our patients when it comes to rural or remote areas, even regional areas, we are lacking in behind what the cities have. So anything we can do to modernize that, and whether that's mobile units, whether that's ideally, obviously, upgrading the facilities that we have and bringing them up to the standard that we would expect for any patient in Alberta. I know everybody believes, and that's what we want to have, is that no matter where you are, irrespective of geography, you will get the same proportioned healthcare services that you can get anywhere, and we're just not there. So I'm hoping that this will start that trend to lead us there, because we have lots of patients that can't travel for even the most basic tests, let alone the most invasive. So this will be a wonderful thing to happen, and of course we'll see how it rolls out over the next 3 years.
And maybe to pick up on the clip that we heard of from the minister a moment ago, where do you weigh in on actual facility upgrades being necessary to attracting new doctors to rural communities?
It absolutely does. As I mentioned in my previous comment, retention of our physicians is the ultimate point to move forward in order to recruit. It's very difficult to recruit new physicians, new grads, or whether they're coming from overseas, to places that don't have a base, that don't have a team, that don't show that there are people there to support you with the most difficult or the most easiest of cases. So upgrading our facilities and ensuring that we have the equipment there is vital. Now, the health human resource crisis, it's multifactorial. Michael, it didn't happen overnight. It happened, and it started with various policy changes that happened in the 90s. At one point, I think governments actually thought they were going to have too many physicians and nurses. I mean, what a lovely time that would be to live in. But that's definitely not going to be the case now. It is unknown at this point if we will ever catch up to the deficit of physicians that we're seeing everywhere. There's the very natural hope that the new medical schools, the Northern Alberta Medical Program and the Southern Alberta Medical Program, will be able to fill some of that gap. But the gap is so large, like it's cavous, it's huge. So we don't know how that's going to go. But again, making sure that we have the facilities there, making sure that we have the upgraded technology, the actual tests and investigations that patients need, is a very good base and a very good place to start.
Well, on that point of the gap, we've heard for so long now about all of the ER closures in rural communities. So how successful has the government been in tackling that issue of attracting new doctors, putting efforts toward recruitment?
So there are efforts towards recruitment, and I know that they have worked with PARA, so the Resident Association, to actually develop some pieces that will help recruit new grads, so new Canadian-based grads, to go into rural places in Alberta. We'll see how that turns out over the next couple of years, because it is a new program that was announced within the last few months. So they are making headway there, but again, This isn't a problem that happened overnight. This problem has been stemming for many, many years, and I personally don't see how it's going to turn around again very quickly. We need to make the headroads. We need to move forward. There are some difficult things and questions that need to happen, though. I mean, there's the very big part that physicians on a daily basis have to grapple when it comes with patients and the patient demands that are coming up. And I use demands very specifically because it's one of the most triggering comments that a physician can have. It's the patients that come in and demand medication, they demand treatment, they demand investigations, all for the simple one-liner of because it's free. And you and I both know healthcare is not free. So we definitely need someone to stand up and provide that appropriate education on this issue. Otherwise, Michael, our publicly funded system is never going to recover.
And if I may ask, what keeps you practicing medicine in the rural, smaller community setting?
Oh, how much time do you have left, Michael? This is a very passionate story for this one. So my former background was I was an electrical engineer, turned into a PhD in epidemiology that turned into a rural generalist. And I did it because when I did my rotations out in rural, it drove my passion for medicine. It made me love it again. There was a time where I was considering actually a career change as a result of needing to practice in the way that it's practiced in urban centers. But rural is it's a different lifestyle, which is fantastic. But the actual medicine, being a rural generalist, having the broadest depth and scope of medicine of any specialty, it's a special place in your heart to be there for it and to be able to care for your patients across the entire continuity of care. Because we are in our clinics, as I am now, we're also keeping our emergency departments open as much as we can, keeping our hospitals running. So it's the passion that drove me, and that's why I stay here.
That's a good message to hear. All right, we'll have to leave it there. Appreciate your time this evening, Dr. Ram. Thank you.
Thank you, Michael.
Dr. Rithesh Ram is a rural generalist and president of the Rural Medicine for the Alberta Medical Association.